Mohit Bhatnagar, Managing Director of Sequoia Capital, and Shekhar Kirani, partner at SL, join us. Thank you very much for being with us. Let me ask you to provide a little bit of context here. Sandeep, tell us a little about GiveIndia's partnership with ACT.
Right at the outset, we realized that COVID was a complicated challenge. It was not something that could be solved with just a single approach. And we realized that partnering with India's vibrant startup ecosystem was important for two reasons. One was its ability to nimbly respond with speed and alacrity with solutions that were economical, but also to come up with novel, innovative, technology-led solutions. And we felt that this sort of a symbiotic partnership between GiveIndia, with our reach across the country through our NGOs, and on the other hand, ACT, which is a collection of top-tier VCs and their portfolio companies, would be a great and strong combination. So at the outset, when we had a lack of PPEs, we actually spoke with ACT. We presented our case to the ACT grants team, and we decided to pool resources to come up with a joint fund that we've now used and effectively built to address challenges around delivering PPEs, around home quarantining solutions, as well as plasma therapy. So we're very grateful for Mohit Bhatnagar, for Shekhar Kirani, and others from the ACT team for being a strong partners of ours right since the beginning.
जी शेखर, मेरा सवाल आपसे है कि अब तक जो इम्पैक्ट कैसा रहा है एसीटी का?
I think this is a question better answered by Mohit.
Okay.
Mohit, would you like to take that?
Okay, so let me go ahead. See, the impact has been phenomenal. We started before the disease got hold in India. So we were the very early to build prevention technology. So we got a lot of war room technology, as well as a significant number of drone tech, contact tracing to lots of states. And as the disease moved to the next level, we had the COVID helplines at various governments so that the panic among the people can be avoided. More than 4 lakh plus calls have been processed by ACT grant given companies. Then as it started to move further, we said N95 and PPE is the critical need in India because it was all being imported. So we got at least 30% of the capacity of India that is able to be manufactured with indigenous products by giving grants to the right set of people so they can scale it. Then became the testing. Testing was just starting out. Again, kits weren't available. So we gave grants to 7 to 8 testing companies that created not only the equipment, but also testing kits. In fact, 50% of the Indian testing capacity is given by the ACT grants team. And while all this is happening, we felt oxygen solutions are missing in India, which is called HFNC, which was very well used in Italy and in US. So we kind of encouraged that 2-3 manufacturers to indigenize again and produce. And that is helping, at least now, in most of the states are ordering these devices. So
that's amazing work, actually. Congratulations. It's very, very inspiring to hear all that. In fact, if I can just ask Mohit Bhatnagar, I mean, all this work that's been happening and how the priorities have changed over time, it's a moving, the way you have an impact is changed during the course of this pandemic, right?
Pranay, I mean, look, we started off like most, first just focusing on PPEs, which is providing protective equipment to our doctors at the healthcare, front. We then moved our efforts towards testing to just try and get a lot more testing done across India. But frankly, right now, our focus is on 3 very specific things that we found to be scalable solutions to really fight back the spread of the disease. The first one is home management. The good news about this is about 85% of people who get COVID can be treated at home, but we cannot let them panic. So there is a whole host of telemedicine solutions where volunteers, doctors, call patients, help them understand the protocol, manage their temperature, their symptoms, and allow them to stay at home while they recover.